Good morning and welcome to today's Shoff Chats. I'm Whitney Ertl and I have the pleasure of hosting our conversation. Today we're going to be talking with Al Larsen, the Vice President of Marketing and Communications for Community Health Network. Al manages a team of 30-some people and they are supporting care at over 200 sites around the state, so pretty impressive. But if you think about the role for Al and his team, think anything from brand positioning, crisis communications, patient retention or acquisition, creative services, event production, etc. They're a busy team handling all of that. Before Al joined Community Health Network about 5 years ago, he served as the Chief Communications Officer for the City of Indianapolis for the Department of Public Safety. He also spent a couple of years prior at the Hoosier Lottery, and then he also had a really interesting career in PR in the global motorsports industry. So really diverse background. Anybody that knows Al knows that he's a servant leader at heart, super strategic, and just very compassionate about what he does and a very inclusive leader. So he's a graduate of Iowa State University. And Al, thank you for sharing your time with us this morning.
It's good to be here. I appreciate the invitation. Yeah, looking forward to chatting with everybody a little bit and really do want it to be a conversation. I think it's important to level set right off the bat that Borshoff did not extend this invitation to us, nor did we accept it based on the fact that we did anything better or best. I think it's just a function of experiences that we've all had, and in our case, maybe a couple of unique experiences in the coronavirus pandemic, but I suspect many more that are shared and not unique, and things that have been have been pain points for you as well, or lessons learned. So looking forward to chatting with everybody.
Great, thank you. And yeah, please feel free to ask questions along the way. Just put those in the chat. And should a fly or any other insect or animal enter the screen, please, no judgment, just a kind heads up to any of us, and we'll deal with that. So yeah. So Al, take us back to the beginning of the year, right? So we're hearing reports of this COVID. You know, there are a lot of unknowns, but, you know, potentially we realize this is a dangerous situation is looming. I mean, what was going through your mind? Where did you guys start? And then suddenly you're at a point where, you have to start communicating with a number of different audiences, right? You know, patients, caregivers, the public, etc. It seems it would be very chaotic and take center stage, but what was it like?
Yeah, chaos found us for sure, like it did everyone else. But it's interesting as I've looked back on it, and I just did a quick sweep of my calendar in preparation for this morning, and January 24th was the first conference call that hit my schedule, and it was a 30-minute call that just fairly benignly says urgent phone call regarding coronavirus prep. And I know it was with 14 or 15 people in the organization, most of which were in our infectious disease group. And we certainly knew that coronavirus was serious, but I can promise you I did not walk away from that first phone call thinking to myself, oh, this is going to redirect the globe for 2 years. You know, that is not, I don't think any of us were there at the time. And so it kind of stayed at that level and then just continued to sneak up. And by the time we got into early to mid-February, then as the virus arrived in the States, then you could really start to understand that we were going to end up in this thing. But even then, you know, none of us had a window into how severe it would be. So spent the month of February monitoring what was going on in other markets, trying to watch news coverage and things of that sort to understand anything you could about it, because we were all seeking as much information as we could. And then for us, things really, really took off when we got into late February and very early March, when we had our first patient present at one of our sites.
And can you talk about that a little bit? Because your announcement seemed very, very public, right? You were coordinating with the governor's office and the State Department of Health. I mean, that must have added an extra layer or so of complexity and approvals. And
sure. Yeah, it did. I think, I'm sure all of us that are in healthcare were bracing for that moment when we were faced with our first positive case. And I know for us, we had a number of moments in the week or so, 10 days maybe leading up to it, where we had patients come in and we were working through new protocols and making sure that, we were dealing with things correctly, but we hadn't had a true positive. And then it was on Friday morning, March 6th. And like any crisis, crisis never finds you at 9:30 in the morning after you're fed and had your coffee and your whole day is clear. We got our first set of phone calls at like 2:30 in the morning from one of our hospitals and said, "Hey, we've just had a patient present and we're pretty sure that it's going to be a positive case, and we're working with the State Department of Health." Our minds immediately shifted again based on what we'd seen covered in other markets. A lot of the coverage that was coming from the media was focused on how well did the hospital handle it? What were the protocols? Were people protected? How did the caregivers handle the situation to keep other people safe? So our minds first pivoted to that to make sure that we followed processes, and we got a really deep rundown of what that looked like at the ER level. And then as the day went along, our media relations team led by Chris Kirshner was in touch and in contact with the state immediately. So State Department of Health and the governor's office, because then at that point, we knew we had the first positive case, known positive case in the state. And at that point, we partnered and collaborated with the state on everything we did the rest of the day, which culminated in a news conference, I think at 4 o'clock that afternoon, that included our chief physician executive, Dr. Ram Yaleti. So complexity, yes, but also for me personally, comfort, because at that point, so much of what we do in crisis is judgment call and seat of the pants. And those are not necessarily, for me, those aren't necessarily comfortable moments, because you don't have an operator's manual. You're leaning on your fundamentals and what you know, but it's nice to have someone to collaborate with. So for us, that was the State Department of Health and the governor's office came together to have that news conference on Friday afternoon. And from there, very, very different environment for the next, honestly, 2 or 3 months.
Sure. And did you just, I assume you set up your incident command and operational calls, and what was that like? Was that?
Yeah, we sure did. Again, looking back, everything is a blur until you really go back and kind of check things. And really from, Saturday, March 7th, the Sunday, the 8th, basically work days when you start looking at the amount of email traffic and everything we were processing. And at that point, we were still in the office. So we were working in our comfort zone of being able to have hallway conversations with clinical leaders that we needed information from. And we were communicating as much as we could internally and externally, but it was still very ad hoc. Things were coming at us so fast, and all of us were drinking from a fire hose, trying to understand the virus and all the implications. So a few days later was when we stood up incident command, and that really, really was helpful for us, because at that point, operationally, we were able to put a framework around what we were doing. And it really helped us too from a communication standpoint, because we now had a governing body we could defer to and really, really double check our messaging and our approaches. So, and then I think it was maybe the 11th or 12th of March when we all scattered from our offices and then ended up working remotely, which, added an entirely different layer of new to everything we were doing.
Sure. Well, and it doesn't feel like it was too long after that where, probably felt like one of those terrible crisis drills, right? A tabletop exercise where things can't get any worse, but then your president and CEO test positive, right, for COVID.
Yeah.
Can you talk a little bit about the level of transparency and communicating that very broadly in the very early days? We thought that was really
so March 22nd, so now we're 16 days past our first case presenting. Sunday afternoon, a couple of us received a phone call internally that Brian Mills had tested positive and was quarantining at home. And so that just took your breath away for a little bit. First, we you're immediately concerned for Brian and his family. And you work through the human side of that, and then you have to get back into, professional mode. And for Brian, for Community Health Network, Brian is incredibly active and incredibly engaged with everything that's going on. So whether it's, he's not a clinician by nature, but he stays very close to clinical leadership to understand what's going on and just do anything he can to help. He's also really close to what we do. So all those thoughts are going through your head. You're the head of your organization. How much is he going to be able to work? We don't want him to work any more than he has to, because he frankly needs rest. But it was so comforting, because immediately that afternoon we were on the phone with him, and he didn't hesitate for a moment to say, look, we need to get something out to the organization first. Need to let them know what I'm dealing with. Let them know we're okay. I'm going to still continue to be alongside them. And he didn't hesitate either to think about communicating externally. Brian just recognized that as much as he moves around what we call the little C community, there was no way that we couldn't share that immediately. So we didn't have a lot of hurdles to clear, quickly moved on to creating the message, creating a plan. And on Monday, the 23rd, we executed everything. Capping it off with, again, his leadership. He put a video together that afternoon from his basement. He still was very under the weather, but had a video out to everybody internally to let them know I'm okay. He wanted everybody to see him. And he said, I'm all right. I'm going to get through this. I'm still with you and pulling for you. And I have a new appreciation for how heroic you all are. And we moved on from there, but he quarantined, I think, for a good 4 weeks. He was in his basement running the show. So pretty amazing. I had a lot of respect for Brian before, but that took things to a whole different level.
Sure, that's pretty incredible. So can you talk a little bit about, you're dealing with obviously the clinical aspect of all of this, and then you've got the operational aspect. And then trying to communicate, internally, externally, et cetera. Policies must have been changing or being built. Did you have this incredible system in place where you could just drop communications and updates into, whatever you had already built, or what did all of that look like?
Yeah, I would love to say that. Gosh, that would be so nice to say, yep, we just had all that ready to go, but we didn't. We just didn't. I mean, I think that's one of the biggest lessons that I've taken away from this thus far with our team is just, we built our communication system and you build it for the non-crisis moment. But when we got into this thing, we had to immediately pivot because we didn't have the system set up to handle this type of crisis. So, and that went for the whole organization. To your point, as an organization, we were building something separate, parallel, alongside our company. So standing up new HR policies and procedures, because travel was an issue. We were in the middle of spring break. People had either already gone somewhere or were about to, and we were trying to understand all that. So new HR policies, new clinical processes. And in the middle of all that, we quickly, as I mentioned at the start, we were ad hoc in our communication. We knew we would get run over immediately if we continued that, and we would hurt the organization. So we immediately stood up at least a wild swing at, okay, this is what we think will work for the organization. But during the first 2 weeks, we did an awful lot of trial and error. So we'd move to a little different cadence, and then go back out to some trusted sources in the organization, leaders, and say, okay, is this working for your caregivers? And they'd say, no, it's not working right now because you need to do this, this, and this differently. So we'd go back and tweak a little bit. I think 2 or 3 days in a row toward the end of that, we made small refinements, whether it was how much we were sending or what time of day we were choosing to send it or to which audience. And that's just internally. Externally, same thing. We were always trying to understand how much can we share with the media and with the public, because we were learning like everyone else was, and you didn't want to overextend and push a message out there that ultimately was going to be misinformation later. So awful lot of learning. But blessed by an awesome team that was willing to do all that. And everybody was nimble, everybody was flexible, and we just changed as we needed to. And I'd say after a couple of weeks, we landed in something that felt as good as it could have during that moment in time.
And I would imagine, like most, hospital and healthcare systems, even on a great day, you're challenged with a workforce that's largely remote, right? They're dependent on mobile devices to get their information and not seated at a computer all day.
Yeah.
There's shifts, etc. So did that add more complexity or, a need for more solutions?
Yeah, it did. And I'll tell you what was really, what we realized really early on, Whitney, was as we were fielding feedback from our leaders, one thing they told us was, look, our caregivers, our first line caregivers are overwhelmed with email volume right now. And at first I was really confused by that, because I'm like, okay, hold it. We were sending like one a day at the network level, maybe two if we had Brian Mills was doing video messages about twice a week. So on some days we'd have a couple messages, and then other days we'd have one. And so I was really confused. Well, then when we really started to dig down, we realized that what was happening is at the operational level, there was so much email traffic flying around where everyone was trying to solve for the crisis. So it wasn't email that we were contributing to, but we had to get our arms around it. So we worked through incident command to shut down as much non-essential communication as possible, and created sort of kind of a vertical flow. So as people were trying to solve operational issues, they brought those up to incident command to get a really clean solution, and then brought things back down to first line. So there wasn't a lot of discussion going on in email about how to attack the issue. So we went after some of those things, but yeah, we tried to communicate first just through our leaders, because we said, okay, caregivers are overwhelmed, so we will lean on our leaders. They're working with their teams. And at the end of the day, what we really found out, another great takeaway for us, was our leaders were not comfortable. Not all of them, but we had enough of them that were uncomfortable as communicators. We had caregivers saying, I'm not getting anything. And so the cascade was stopping at the leader level. So then we ultimately opened the flow up to everyone. And now it's been a takeaway for us to make sure that we do the work to get our leaders on better footing as communicators, so they can really be part of the solution and not be put in an uncomfortable position.
Sure. And would you say email is still the preferred communication tool for your organization? Have you shifted to other means,
Yeah, it's interesting. I won't use the word preferred, but we rely on email, but that might be a curse more than a blessing. I think we are too email reliant at Community. So we're seeking ways to become more multi-channel. When we got a little deeper into the early month or so of the crisis, one thing we started doing to try to diversify a little bit in our channels was we created basically an audio version of the daily message that we were sending out. So we still are, we're sending a daily brief out. And we ultimately decided, you know what, there's probably folks who just straight up are going to avoid reading anything if they can. So with the help of Chris Kirshner, bless her heart, every day, and she still does this every day after we get a briefing ready for the next day, she gets in front of a mic and puts an audio file together. And so now it works well. So someone can either be leaving the hospital, hit that link in their car, and as they're making their commute home, can consume everything that they need to, or on the way in the morning. So we've tried a few things like that. We've tried a little bit of hard copy here and there, not en masse, but we have tried to experiment a little bit. But the long answer to your question is, email is still what we use. We've got to get further away from it, because in this day and age, not just within the workplace, but just culturally, everything is fragmenting and segmenting further in terms of what channels people prefer and how they want to get their communication. And we need to meet them there, or we're going to fail. So we've got to work on that.
Right. That's interesting. Let's shift gears just a little bit and talk about the external communication and your marketing priorities, and how did all of that change as soon as COVID hit? You know, I imagine you were probably advertising and marketing to patients for elective procedures, and then suddenly there's a shift that's needed. What did that look like?
Yeah, good question. Our marketing team did a really good job with everything. This was so counter to everything you do in the marketing space, because you spend months planning and laying a strategy out for the long haul. And on a dime now, you have to go back and reel all of that in as we started to shut sites down and switch to virtual platforms and things of that sort. So we had to quickly audit everything we have in flight, reel it all in, and immediately we're very heavily based in research when we think about our marketing work. And so immediately we had to understand what our patients and consumers wanted and what they needed. And so had to quickly stand up some research to understand all that, and then create new messaging and get it back out, not only to meet the needs of what consumers were asking, but we also had major operational changes, right? Because so many sites were now offline, but or pivoted into a virtual space. And so amazing to see the marketing team do that, because again, so counter to what they do on a daily basis. They are strategic in nature. They're thinking quarters and quarters and quarters down the road. And now they're doing everything a day at a time, trying to just keep up with how the crisis was changing.
Right. And so how does that carry you into next year and how you'll prioritize for 2021?
Yeah. I think for us, it's about having truly sort of a plan A and a plan B. So there's the plan A that's ideal if we don't encounter a severe reaction to the surge like we saw back in March, April, May. So that's sort of one track in our minds, but alongside that, we have to have that agility built in to our thought processes to make sure that we can pivot quickly. And we've been through it now, which helps. And I think as we talk to our clinical leaders, we also, knock on wood, don't expect that while we do expect surges and we do expect a tough winter, we're certainly much better positioned to handle it, as not only as a system, but as a healthcare industry. Mm-hmm. So I think we're hopeful that we won't be rocked as hard as we were the first go around, but really it's about having both plans in mind and knowing which lever to pull when the time comes.
Okay. Hey, Whitney.
Yeah.
We do have a question that I'd like to share for Al. So Karen says that communications are fundamentally important to organizations, but sometimes viewed as an extra. Did you see an enhanced respect or a newfound appreciation for marketing and communications within your organization because of the pandemic?
Yeah, Karen, great question. And yes, we did, which was really a nice silver lining in this whole mess. I'll indict ourselves when I say this, but I may be being a little too harsh, but I'll indict myself. We had allowed some bad organizational habits to develop from a communication standpoint over time, just again, because we're not under the pressure of a crisis. So you're not feeling how that will fail when the time comes. And a lot of that was because we never really rocked the boat too hard within the organization, probably to say, hey, we need to do this differently, or we need this tool. So when the crisis hit, I by nature am more of a ask for permission rather than forgiveness. But when the crisis hit, whether it was adrenaline or whatever it was, I went the other way. And so we started just doing what we needed to do and stop kind of asking for permission. And we decided we'll sort out the forgiveness piece later. And we went out and just had to break some things and do what we needed to do for the organization. Getting back to your question, that was met with respect, and it was met with partnership by our executive leadership team, where they then had some input in terms of, okay, I see where you're going and I like it. Here's where we want to go a little bit further. And they've responded well for us as we look at the future in terms of looking at a really nice digital platform for us now to work with from an internal comm perspective. So it has been a silver lining in all of this, but absolutely there was a heightened sense of respect for what we do in that space. And you're absolutely right. It's too often forgotten or downplayed.
That's a great question. Thanks for that response. Al, as an agency, we have worked in the healthcare space for 35 years since the agency started, really. And I think we are always in awe and total appreciation of caregivers, but I mean, we've never seen anything like this, right? So, you know, for everyone out there working at, you know, a community or different hospitals and healthcare systems, you know, long-term care facilities, nursing facilities. I mean, the list goes on and on. It's been a stretch, right? I mean, has there been a real break in terms of how people are looking after their wellness, or any tips or advice that you can give to the group? Because, you know, if the caregivers aren't taking care of themselves, how can they take care of others? And that's, you know, so critical.
Yeah, that's a major concern and continues to be. Because you're right, by nature, first-line healthcare providers, whether they're doctors, nurses, techs, EVS, they don't think what they do is special. They don't think what they do is extraordinary. That's kind of how they're built. And I found the same thing when I worked in the Department of Public Safety, police, fire, EMS. They don't think that way. And so you have to almost protect them from themselves, because they just do what they do and they keep going in. And so, first of all, I think that's always been very grounding for me, in the sense that I can start to feel some stress. And then if you get an opportunity to talk to anyone that's in the clinical space, then you're immediately pulled back to, like, you know what, I'm sitting in my home office dealing with this pandemic. So hush, because you've got it easy, and that helps a lot personally. But I think for us, from a communications perspective, one thing, we started from a position of information only, need to know, just sharing things that absolutely had to get out there, policies, procedures, processes, that type of thing. Not far into it, we were getting feedback from our first line group that inspiration needed to be part of our mix, because they needed a life preserver at times. And so our video team, again, led by Chris Kirshner, they did a ton of work they were constantly in the video production cycle for inspirational videos, whether they were messages from leadership out to caregivers about how proud we were of them, or just peer-to-peer videos showing people getting through this and staying together and that type of thing. And so a lot of inspiration then had to be sprinkled into what we were doing and strike that balance. And then there's a different part of our organization on the HR front and just clinical leadership, again, that is focusing really acutely on that long-term well-being, and making sure that we have caregivers that are tapping out as they can, because we've got to take care of them. We need them for the long haul. And again, they're just not wired in a way that they're gonna raise their hand generally and say, hey, I need a break. That's just not who they are.
Right, right. And what takeaways have you had, either, you know, personally or professionally, that really stand out through all of this?
You know, I shared a couple, just obviously on the just pure work product, but, you know, again, I think, I don't like crisis. So I know there are people out there that say they thrive on it, and that's great. I'm not that person. I don't like crisis. So you get through it and you do it, but it feels awful. It's not something I enjoy. For us, I would say it felt like a crisis for probably 6 weeks. And then it really leveled off in an altitude. I think part of that was it did ease back a little bit. And then I think we also just adjusted to a new normal. But yeah, personally, I don't like crisis. And I think also, again, any of you that are in healthcare can relate to this. If you're not in healthcare, understand when I say this, like, wherever you work or wherever you decide to work, if you get a chance to work with people like that are heroes, gosh, it makes getting out of bed in the morning so much easier because it's so meaningful. That makes such a huge difference for me. And I learned that when I was at the Department of Public Safety. I think that's when that light bulb went off for me, that if I can be supporting people who are doing life-changing and life-saving work, gosh, it's pretty easy to come back the next day and be like, you know what, I'm going to do this again because I've got to do my part. I can't lay hands on anybody and provide care, but if I can provide care to those who are, it sure makes things easier. And this whole experience has really reinforced that for me.
Oh, that's really neat. And so where will you guys go from here? What does the rest of 2020 look like and headed into next year?
Yeah, I think for us, it's about don't become complacent. We stood up a lot of new approaches during the course of the last 6 or 8 months. And I think for us now, it's about auditing those. We just had a quick meeting last week on the internal front a little bit, even to talk about, okay, are we still in the right spot? Do we need to do anything differently? Where are we at with this or that? And just took a step back and slowed down from producing for a minute to just take a 30,000 foot view. So I think we need to do that because we know, again, I think as we get into the winter, we could have some tough days or tough weeks. And so we need to be well prepared for that and not be chasing it. So I think for us, it's about preparation and then just stay disciplined. It's a long haul. We've got a long ways to go in this thing, and can't get lazy, can't get sloppy, can't cut corners. So I think that's just kind of where we all are, and taking care of each other. It's hard in this virtual environment that we are as a team. Our team really thrived on being together, making eye contact with each other and grabbing coffee or going to lunch or whatever. And we just don't get to do that right now. So we have to find new ways to make sure that as human beings, we're still feeding each other. So that's a few things, I think.
Right. And I guess if anything, you've learned to be more nimble, and hopefully, that will stay in place.
Yeah, absolutely. You mentioned, the crisis drills that we've all gone through, and I don't think, I'm probably going to offend a crisis facilitator when I say this. I just don't think you could prepare for this. I just don't think we've all been through those drills, and you try to take them seriously, but it's hard to drill for something that with this magnitude for this length of time. And so, yeah, we've got all that experience now. And part of that was that ability to be nimble, take things at times, literally an hour at a time. Like, okay, we're going to plan for the next 60 minutes, and then we're just going to figure out where we're at after that. And you got to be flexible. So yeah, certainly have learned that. And I don't think it'll ever leave me now.
Good.
Al, we have another question. Whitney, if I could just interject. So, and you talked earlier about the channels, and you mentioned, for example, the use of email, but how you also tried to inject some new things such as the audio posts, which sounds like a great idea, especially for those who don't sit in front of a desk all day. What other channels worked best with communicating with employees, and how did you also use your executives? You mentioned kind of the inspiration versus information part, but are there other ways? And maybe you could even talk about how, if you didn't have the opportunity to do that yet, maybe that's influencing where your thinking is going for 2021. You did mention like a new digital platform, so perhaps that's the beginning of it.
Sure. Yeah. So other channels, failed to mention this before. This actually played a significant role for us. So I appreciate the question. So like most organizations, we have an intranet, and it again was built to function under normal circumstances. So really proud of our intranet space. It's a SharePoint based site. And I think it's been, 2.5 years now since we relaunched it, and very proud of what it was and how it works for us under normal times. But we really needed to lean heavier on that as a hub and a central source of truth, not only for for information that we would push out through our emails, but really as a link back to process and procedural documents that were changing very rapidly. As an organization, we didn't necessarily have a spot to house a lot of these new policies and such that were being stood up on the fly. And so our digital team did an amazing job over the course of maybe 10 days, effectively built a microsite within the structure of our intranet, and we redirected all the hits to that microsite. So we stood up what was a COVID-19 site. We took heavy feedback from our clinical side and basically built everything into two buckets. One was caregiver information, one was patient information. And it made it very easy. It was a very sparse site, but it was exactly what we needed in the moment. And so anytime you tried to go to our intranet, it just redirected you automatically. There was a walk back to get to the other site if someone wanted to do that, but we pivoted that way. And I can't say enough about that team, because they're trying to feed this beast that is our intranet all day long, and then at the same time stand up this other microsite. And they did it over the course of about 10 days. We used that site until, oh my goodness, I think into about the 1st of June. So probably 3 months we were using that site, and then we finally migrated back. But the other one is still sitting there queued up. We've done some cleanup on it, some different things like that. But that was a major piece for us in terms of a channel. Yeah, and then into 2021, again, we're going to work with a digital platform called Dynamic Signal. Super appreciative of our leadership for being open to that and giving it a look. And it will allow us to more efficiently curate our content in one place, and then ultimately distribute it through multiple channels, and in a way that the user can determine how they want to get it. So it's going to start to be user driven, which is where we need to be no matter what. So going to take us a while to get that to a place where it's working, where we're using all the capabilities of it. But that's going to be really good for us in 21, I think.
That's great. So, and actually we have a comment from Kate that I think is really interesting. And Kate, if you'd be willing to share, I think it would be great to hear a little bit more about the comment that you made. She says she's getting ready to drill with a client next week on a complete internet outage. So, you know, what would you do if you didn't have the opportunity to use your intranet or create a microsite? And that really could be a challenge, because we all are very used to those digital components. So, Kate, I'm not sure if you're able, you don't necessarily have to give us a lot of specifics, but I'm just curious where your thinking is going with that actual drill and maybe some alternatives to digital platforms.
Yeah, absolutely. First, hi, Al. Hi, Whitney. Good to see you guys both. And you're doing a great job. Really fascinating conversation. So drilling with a client next Tuesday on the internet outage. I think their concerns are primarily around the election, which I don't want to get into all of that stuff, but I don't think that they would have thought at that scale. I didn't bring the idea to them. It's somebody that I work with regularly. They're the ones that put it forth. So looking at things, you know, what kind of apps can we use that don't involve the internet? You know, the old phone tree. How are we communicating? I'm not kidding. Does everyone working remotely, does everyone have a list of everybody else's cell phone, or is it just your team that you know, just small little things like that. How are we communicating to our clients? The internal communication piece, we're going to talk about operations and payroll, right? How are we going to do that if the internet is down, in this case, for 7 days? And we're looking at both sort of a national outage and then a local outage as well. But I just thought I would offer that. I don't think a year ago anyone would have said, let's drill for the internet going down. And that is, Al, when you were sort of talking about it's difficult to drill for these things, it absolutely is. And the scope has changed, I think, post-COVID.
Yeah, Kate, that's it just makes me nauseous to even think about that scenario, but you're right. And that's what, I mean, crisis drills are great, and they're only great if when you get to the end of it, you feel awful, because it's about driving yourself to failure, right? In one of those drills, you really need to get to the point where the organization breaks so that you can say, okay, that's as far as we can go now. We've got to learn how to go farther. But gosh, that's such a great thing to drill on, because everything we've talked about in the last half hour, 40 minutes, my goodness. Yeah. If we lost our ability to do it electronically, where would you pivot? So yeah, good for you for taking that on.
Al, we do have one other question from Amy. She's asking, was the timing of internal and external communications affected by the hospital system's required reporting to state and federal health authorities? Were there any members of your communications teams that were required to really pivot during this time and change their role to something maybe they wouldn't have normally undertaken?
Ask the first part of that again for me, please.
Sure. It's really about did any sort of required reporting to state and federal health authorities, how did that impact the timing of how you did your communications with internal and external audiences? Did you have to delay things maybe, or?
I think we were largely insulated from that. However, I would say this, I think where we probably saw that present itself was as our media relations team, Chris Kirshner, Bobby Brooks, as they were taking inquiries from the media, there were times we were not in a position to share data points that we were being asked about. And I have a feeling that may have been what was driving a lot of that under the surface. I'm not positive on that. Some of that was probably related to the reporting requirements. Some of that I know was related to the fact that we were being asked a lot of questions about modeling and forecasting and things of that sort. And our analytics team just did not feel comfortable with a shallow data set to step out and make some very, what would have been some very high profile predictions about where this is going, because everybody wanted to know the future. So I think we were probably impacted in a few different ways with our external requests and what we did in the media relations front, but maybe a little bit in that reporting piece. What was the second part?
I think the question was, were any members of your team required to pivot to roles that they normally would not have undertaken?
Yeah, great question.
Curious to hear, how the different roles were impacted and how people were stretched beyond what they
Yeah, great question. And I'm glad you asked, because they deserve credit for it. Yes, absolutely. And I think we saw it more on the marketing side of our team. It was so impressive to watch various skill sets come to life that we don't take advantage of every day, because people are, whether they're supporting a product line or our brand or whatever it is from a marketing perspective, we reeled all that in very quickly, and we ultimately needed to run to a number of different fires around the organization. And a lot of it was in the communication space. And a bunch of our marketing team members did exactly that, and we didn't miss a beat. And so we went from having a finite number of communication people to more of an infinite number of communication people, because they were all able to lend a hand. And it was so, you just don't realize. I mean, you feel like your team is talented until you see that happen, and then you're like, wow, I didn't know how deep that talent went. So really, really impressive. But yeah, it did hit us on the marketing side for sure.
Now, Al, you guys have a video studio on site, don't you? And do you continue to use that in the same way that you did previously?
Yeah, yep, we do. We did not use it for, I don't know, probably 3 months, March, April, May. Suspect we probably opened it back up in June when we started to open up society a little bit more. But we put some very, very tight guardrails around its usage, how many people could be in the studio, limited all of that to a significant amount, spaced out any usage of the studio. I mean, in normal times, there were days we would have one interview after another filtering through there for provider bios or different things like that. And we spaced all that out so we could fully clean everything before someone else came in. We did an awful lot of video just from home. We had a bunch of leaders who were either really savvy at doing it or they learned how to do it from our video folks. But yeah, the studio is back in use now, but on a limited basis, and with really, really careful protocols in place.
Okay, great. Just one more question, I think. And folks, if you have any other questions you want to submit, please do so. But can you talk about the role of spokespeople throughout these last several months, and also the role of executives? You know, did you pick a couple of people, or did they have to swap out, or what did that look like?
Yeah, thanks. Good question. Yeah. We landed in a pretty good place from my perspective. Over the years, Chris Kirschner and I have talked about this a lot. Depending on the crisis moment, we've moved around quite a bit in terms of who speaks to it. And some of that sounds natural and normal, but some of it made us uncomfortable because we just never really felt like when a crisis hit that we knew necessarily who our go-to should be. So it was a little bit of a blessing and a curse in the past. I think just because of circumstances and because of the way that first patient presented to us and became the first known positive case in the state, for whatever reason, we landed right away on Dr. Romuletti. And as a secondary clinical spokesperson, primarily Dr. Robin Ledyard, our chief medical officer. Those two, coupled with Brian Mills and then Chris Kirschner in her role as our corporate spokesperson, we really landed on a core group that have carried a lot of the external messaging throughout the course of this crisis. We've had a couple of other people who have participated, whether it was on the finance side or the analytics side or operationally. But for the most part, we landed on a core group, and it has been incredibly comfortable. They've done a terrific job for us, been so responsive, and have given us what we've needed. So it's really been a blessing.
Wow. Well, Al, thank you for everything that you've shared. I think we could all probably sit here and talk on and on, but in the interest of time, we will start to wrap up. Just a quick plug, our next Shoff Chats will be October 21st, where we're gonna pivot a little bit to sports and attraction and how they've weathered the pandemic. And our speakers will be Joel Zawacki from the Indianapolis Indians and Dennis Werner from the Indianapolis Zoo. So please join us if you can. We will make today's conversation available on our website, both in video form and with a blog. And again, Al, I just want to say a huge thank you to you and to your team for everything you guys are doing. And again, just a thank you out there to all the caregivers taking care of folks in Indiana and beyond. So thank you.
Yeah, thanks for having us, and thanks you to everybody for joining and for just hanging in there. I know, healthcare or not, regardless of where you're working and what you're doing, I know you're going through extraordinarily difficult times, and just hang in there. We got a little ways to go, but we're all going to be better when we go through this and get to the other side.
Indeed. Okay. Well, thank you.
Thanks all. Have a good day.
Thank you.